Welcome to the Silver Support Network. My name is Christine Meek, and I am the founder as well as a health insurance broker. So, whether you're turning 65 and trying to figure out Medicare, or you're retiring before 65 and now have to figure out what healthcare plan to choose because you no longer have your employer plan, I am here for you. I get to tell you today who I am, why I do what I do, and how I can help you. So I have always loved education. From the time I was little, I wanted to be a teacher. When I grew up, I've had careers as a computer consultant, a classroom teacher, science for middle schoolers, all the way up to adjunct professor at a university. I've been a financial advisor, a loan officer, even a notary. But now in the Medicare space, I am so glad to be able to help people navigate the mystery of how to get the right plan with the right cost and the right benefits and make that all work. When people sign up for a healthcare plan, they want to make sure they consider all the aspects: your health, doctors, medications, your budget, your lifestyle. Do you travel? Do you live here half the time, there half the time? And your family history. And there's more. I want to know what's important to you. Do you care more about a large network? Do you care more about low premiums versus high deductibles or low deductibles? There's a lot to consider. You can do it yourself. You can go to medicare.gov or Connect for Health Colorado and try to figure it out on your own. But you'll find that there are between 50, 60, sometimes up to 140 different plans. And how do you choose the right one? We, as Medicare brokers, have to go through a lot of training every year. And then each company that we sign up for also has their own training. So we know what the plans are, who they're best for, how they fit into the grand scheme of things, which has the highest ratings, which have the lowest issues, all the things. And when you work with a broker, it costs you nothing. Because we get paid by the carrier that we eventually sign you up with, we have no cost to you. There are some people that are nervous when they work with a broker that we're going to force you into a plan that pays us the most. And perhaps that's true for other brokers, but it's not going to be true for me. I can tell you that when you work with me, I will educate you on what your choices are. And then from that, I would let you make the decision. I always give multiple choices so that you know I'm not trying to box you in to a certain one. I have two clients that I have really just loved. One, super smart guy. He was an executive. He knew that he had to sign up for Medicare and he was going to do it himself. He does most things DIY. And he missed the window by 3 weeks. See, when you sign up for Medicare, you've got a 7-month window, 3 months before you turn 65, the month you turn 65, and 3 months after. And he didn't sign up until 3 weeks after that, which means that for the rest of his life, he'll have a 10% penalty that he'll be paying every month. Now, he's kicking himself. He knows he could have done better, but it would have been really nice if he had somebody that he could have walked alongside with, who could have kind of poked him and prodded him a little bit more to make sure that he did it on time. I've got another client. She was so overwhelmed with signing up for Medicare that when she finally did it and she finally chose a plan, she just never looked at it again. And after 6 or 7 years, when I caught up with her, we sat down together, we looked at her plan and realized her benefits had gone way down, her costs had gone way up, the medications weren't being covered the way that she thought they were. And so helping her and her husband get into different plans, I saved them more than $5,000 for 2024. Now, I can't promise I'll be able to save money for all my clients like that, but making sure that we get you in a plan in the beginning so you don't have those issues, that's what I love doing. I want to be able to help as many people as I can. So I love public speaking. And so, of course, I'm talking about all things Medicare, about changes that are happening in 2025. But I'm also talking about fun things like neurobics, which are exercises for the mind, keeping us sharp, decreasing memory loss, and improving mood. They are fun, interactive talks that I love giving. I also talk about the 5 keys to age in place safely and successfully. Personally, I have lived in 34 different homes, apartments, corporate housing, all of it. And I know I have one more house that I have to move into because the house I'm in currently has multiple levels. It's a tri-level with a sunken living room. If I need a hip replacement or my husband needs a knee replacement, we've got stairs everywhere we look. So I know it's not a safe home to age in place. So that's one of the talks I give is how to age in place safely and successfully. And then I also do a couple others. But no matter what it is, I make sure that I always have fun with my audience. So, in conclusion, if you need someone to walk alongside you to choose a healthcare plan, if you have a group or know of a group that wants a fun, interactive, educational seminar, I could be your keynote speaker for the day. And even if you just need information and just want to bounce some ideas off of somebody, I'm here for you for that too. Make sure you subscribe so that we can stay connected, stay informed, and stay independent.